Hello, my name is Catherine Gooday and I'm a podiatrist from the UK. It's great to have an opportunity to speak to you in Diabetic Foot Awareness Week. I have been a podiatrist working in a large multidisciplinary foot clinic for the last 20 years at the Norfolk and Norwich University Hospital. I am developing a clinical academic career and I'm in the final stages of completing a PhD, the focus of which is Charcot. Alongside this, I have also been working with the National Institute for Clinical Excellence and the International Working Group on the Diabetic Foot Clinic to provide evidence-based guidelines on the prevention and management of diabetic foot disease. We all know that living with a diabetic foot ulcer or other diabetic foot complication can be challenging. It can have physical, social and psychological effects and can render the individual less able or unable to work. These things can affect the individual, their families and their relationships. High quality, effective care has been shown to reduce the risk of diabetic foot complications, with more ulcers healing quicker, less hospital admissions and less amputations. The first question I've been asked to think about today is, should there be more awareness around diabetic foot complications? Well, yes, there's always opportunities to increase awareness for both patients, people with diabetes, healthcare professionals and policymakers. But there is some good news. Results from the National Diabetic Audit in England and Wales have shown that the number of multidisciplinary foot teams is generally on the increase, and people with diabetic foot ulceration are presenting earlier with wounds that are smaller, less infected and shallower, which heal quicker. The second question I've been asked to consider is, what are the advancements in terms of diabetic foot disease? I would like to consider these specifically in terms of podiatry, as I am a podiatrist. The early pioneers of podiatry in the world of diabetic foot disease, Ali Foster, Neil Baker and Alistair McInnes, have really led podiatry to be at the forefront of multidisciplinary diabetic foot care. I consider podiatrists are now the clinical champions of diabetic foot disease. Podiatrists are developing leadership roles and, like myself, research roles, trying to improve the care pathways and the evidence for diabetic foot disease. We are also developing our clinical skills, and podiatrists are more commonly now independent prescribers, ensuring that people presenting with infected diabetic foot ulcers can have prompt, rapid access to effective treatments. We can also arrange and interpret laboratory and diagnostic investigations, and are involved in more advanced wound care technologies, which will hopefully all improve the outcomes for diabetic foot disease. The next thing I've been asked to consider is the challenges, and the main challenge I consider is the lack of high quality evidence that can be used to inform clinical guidelines. My work with NICE and the International Working Group on the Diabetic Foot Group has shown me that much of the evidence that we use to develop these guidelines is based on case studies and expert opinion. There is a real need to develop high quality, well-designed, well-conducted, randomized controlled trials to answer the clinical questions around diabetic foot disease. These include: how do we prevent first ulceration? What are the most effective treatment strategies for foot ulceration in terms of things like wound healing interventions, management of infection, vascular reconstruction? There's many things we need answers to. And finally, understanding why we have such high levels of re-ulceration and what can we do to reduce these. We also need to ensure that we're involving people with diabetes, expert by experience, and try to understand the lived experience of diabetic foot ulceration. If we have a better understanding of the lived experience, I think that this will contribute to more constructive and effective relationships between people with complications and healthcare professionals, and ensure that we develop pathways that are patient-centred and focused on patients' priorities. Finally, I've been asked to consider my career in podiatry, and I can honestly say I've never regretted a career in podiatry. I've worked for 20 plus years, and it's been a fantastic job. I've been involved in all kinds of things, and would definitely recommend anybody considering a career in health has a look at podiatry and what it has to offer. There are many challenges still in improving the care of people presenting with diabetic foot disease, but there are lots of positives, and there's a real momentum to change. And I hope that we will all continue to work together to reduce the variation and improve the outcomes for people with foot ulceration and other complications of diabetes.